So we'll do the second demonstration on the sideline. I'll do again the preparation. Is very important, just to show you the difference between if you have a small towel or if you have this fleece blanket. It's fantastic. You can really be sure that they're not exposed in any way, okay? So again, starting by saying, can you move and lie on your left shoulder, please? Good. Good. And then fitting nicely the first pillow on the head. Yeah, lift your head. Thank you. Putting it all the way in, parallel to the axis of the head, and the head is in the middle. Then, pushing the elbow at the knees, give your clients just a hint. So what I'm doing is this, and then pushing it in. Yeah? Lift your knee, please. Good. And then, second towel, I was a bit unclear. I'm doing it the same as I'm doing facing down or facing up. Taking it up, lifting it, I'm tucking the lower towel, you will see why soon, and then putting the top towel, so the T towel, I put the top towel above. Last thing, lift your, can you bring this out? Thank you. And then tuck this under. Tuck the towel. Good. And then you can come and hold the pillow this way. Yeah. As they want, you know. It feels good for most of them. Okay. Then we can really start. Good. So, what we're going to do, we'll do the neck and the shoulder now. And then after that, we'll do the rest. For that, all you can say, can I take this down, the strap? Yeah, good. And then, any oil, please?
Or some underneath.
Good. So, few techniques before you actually use the, you use oil. First of all, you can do really nice stretches here, from here. Yeah. Putting this a little bit back. Okay, so nice stretch would be that. And a little bit of stretch, and it was coming in the final assessment, is that don't make a big fuss of the stretch. Just, you know, you massage, and then kind of a nice stretch, and then again, massage or move it a little bit, and then stretch it a little bit, yeah? So you can do nice stretches here. Have we done some mobilization? Mm-hmm. Good. Now let's do the shoulder mobilization. You can do it in a few ways. You can put the shoulder, the arm here, and limit the movement. One hand here, one hand there, and then from there move your body. So all the way up, all the way down, all the way in front, all the way back. 360 degrees, yeah? Good. You can just nicely track that. Now we can do some more with oil technique. Again, you're lowering the strap. You can come from here, apply a bit of oil, and the good thing that it allows you right range of technique that with freedom. So you can start, really nice technique I like, is coming in front of them, one hand stabilize their head, and you can actually just by applying a little bit of pressure on the head. What happened when you apply pressure on the head, that they have to relax the muscles. It's a kind of neurological reflex. When you're feeling more heavy, you're relaxed more. And then the other hand, you start with the suboccipital area, Very slow. And then you continue with the neck erector spinae muscle. And I like this technique because it's just very comfortable. You're just putting your hand, one hand stabilized, the other hand really minimal finger petrissage. Yeah? But where I like to take it is to start moving it, moving the head. So it's a bit of more mobilization. Yeah? So this hand is on the scalp, and this hand, especially these two, the index finger is on the suboccipital area. Good, and then you can work very delicately on the erector spine, very slow. And there is a little bit of, do you see how little mobilization I do there? Little bit. Yeah, good. You come on to the next technique, upper trapezius. You come into here and you have a fantastic knuckle work on the upper trapezius. You can do it from here. You can do it from here. You can move the shoulder a little bit. Good. Then you can start moving the shoulder and then work on the upper back. What I really like to do here, and if the camera and you can come a bit closer to, I tuck my fingers. If this is their spine, and I feel the spine, I tuck the finger just underneath it. So I use the spine to kind of mobilize.
You have to be quite gentle doing that, don't
You'll be surprised. On client with tension on the back, neck, shoulder, it will be really, really good technique. Yeah. So I am, again, this is the spine, I feel the spine, I go underneath, I hook it in, and then mobilize it. And I work on the muscles and all the spine itself. Again, if your client has osteoporosis, are you going to do it? No. If your client has a prolapse disc in this area, are you going to do it? No. If your client has rheumatoid arthritis, no. But on a normal, healthy person, that will be really, really good, which is 95 or 99% of our clients. Yeah, good. You can then come and work from here on the trapezius muscle. You can do the knuckles here, really nice. So I'm starting from there. Everything I do to keep my wrist joint straight, I start from here, and then when it goes up, I go down. You see that? So I go down, stretch it, sustain it. Good. Again, one here, shifting the weight. Shift your weight, a lot of the weight from side to side. Good. Again, you can work on the spine. Yeah. Finger movement.
That's on the upper.
This is on the, if this is the spine, you work on the closer to you. Ipsilateral, it's called. Ipsilateral means the same side. So same side where you are. Yeah? This technique here would be a little bit dangerous. Why? The neck is a lot more vulnerable. But on the upper back, yeah, you can do this, you can move it, you can work. How many massagers work on your infraspinatus muscle?
Not enough.
Very much not enough. So how do you find the infraspinatus? If this is the scapula, you go from the side and you feel the edge of the bone, and then you go a little bit more in. And it feels actually a ridge. It's a ridge, and a lot of people, tension would be there that would cause numbness in the arm. It's quite amazing. And that's a trigger point. Welcome to trigger point, yeah? So really work on this space. We're all so concerned about the back. a lot of people, the shoulder is actually the problem. So work on the scapula, on the muscles on the scapula. And the muscle of the scapula, if this is a scapula, I'm thinking, okay, the medial side, which is rhomboid, the upper side, which is trapezius, and one more.
Supraspinatus? No?
Yes?
Some levator scapula. Supraspinatus is more, you're right, but it's more intrinsic muscle to the shoulder joint. It's not a big muscle. The lateral one, and that's where the lateral muscles we never work on. Yes, it's the rotator cuff, which is, you're right in terms of location, but in terms of function, supraspinatus is more stabilize the joint and abduct. So we're looking at the top, lateral. Now I'm concerned more into the medial side. So I need to find what the position. So the first hand is on the front, and then the second hand, I just really find how to move it, how to do with it. So, and I move it and massage with. And when you're thinking that's advanced technique, you take two simple technique and you just mix those two. Yeah? Can I go deeper? Or? Yeah? Good. Let's swap. Come in the front, please. Come into the front. And how many clients you know that the shoulder forward, located forward? Quite a lot, right? Which muscle would be tight in front? Pectoralis, right. So what you can do to work on that, you're putting your knee there, not on the spine, a little bit more above, and then you can put the hand in here, and then you can work and stretch nicely this area. Yeah, either you put that, you can work finger kneading, yeah, and then bring it to you, so you actually stretch the upper part. Yeah, you do actually that, and if this is not enough, you can work quite nicely with just very slow stretch of the whole upper limb. Yeah. Can I go more, or do you feel the stretch?
Yes.
Or even this way. Yeah. So don't forget your client has the front when it comes to shoulder. And a lot of the time, client comes this way, protracted. Yeah, protracted with the shoulder. And we work too much on the back. We need to work on the front to allow it to stretch back into its place. Yeah, so really put attention into it. Okay? I think it's enough, isn't it? Yeah, so can I remind you everything? Started effleurage, the technique with stretches. Yeah. Shoulder mobilization. A nice alternative to shoulder mobilization is put your hand underneath, one hand here, and then mobilize it. It's very safe for them. It's a lot harder for you to do. A little harder because there are so many positioning, but if you get this position right, so again, first contact, second contact, third contact, fourth contact, they feel very stabilized and very nice, and they will relax more. Then, coming to here, we do the neck, even the scalp. Yeah, neck, coming from here, upper trapezius. Remember this movement on the spine, from here, and then coming the opposite way. Okay? It's a lot, and I know it's not easy. And it's not easy because the positioning, your positioning, your client position, it's a lot more settled. And there is a lot more to make mistakes here. I want you to do the mistake. I'm not interested. We've seen so many of your effleurages. Okay, so you know how to do effleurage. We saw so many of the petrissage, then okay. But slowly make the learning progressing slowly and take the risk and honor them. Okay? So let's start and we'll be helping.